Anxiety is very common in the United States. In fact, it is the most common emotional disorder. It's estimated that 1 in 5 Americans suffer from a clinical anxiety disorder, although we suspect that number is underreported. We know, for instance, that only 1/3 of the individuals in America that are suffering from an anxiety disorder actually seek out direct treatment for that disorder. Anxiety very much tends to run in families. In fact, at this level, it's kind of a double whammy. For instance, if one or both of your parents suffers from anxiety, whether or not it's been diagnosed, you're likely to inherit at the biological or genetic level the tendency toward anxiety. But this is where the double whammy comes in, because if one of your parents or both of your parents suffers from anxiety, they're likely to parent you in a way that brings your anxiety forward. Without intending to, an anxious parent is modeling for you what it means to be an adult, which means, in their mind, to have a lot of anxiety, to have a chronic state of worry. One of the most frustrating symptoms of an anxiety disorder is something that we call anticipatory dread. This works as follows. Suppose you are called upon to give a presentation in a business meeting, but you get very nervous, you feel paralyzed with anxiety, maybe you even have a full-blown panic attack. Unfortunately, that experience creates a clear memory, a negative memory. So even if you know that you have a business meeting, a presentation coming up 6 weeks in advance, you may already start to anticipate that. You may already start to dread that well in advance. So you may find 2 weeks before this business meeting that you're losing sleep, that you're already worrying about it, you're obsessing about it. So part of what we have to work with in treating an anxiety disorder is lessening this anticipatory dread, teaching the client to be more in the here and now, not creating problems for themselves in the future.